Well, welcome, David. Thank you so much for joining me today. This is a new series that the Foundations at Health Sciences North is launching to really get the community to know a little bit about you and to know a little bit about how philanthropy plays a role in our community and how it plays a role in delivering excellent healthcare here at Health Sciences North. So on a more personal note, David, you kind of grew up here in Health Sciences North. What is it like to be back and supporting your home community?
Well, as you know, my story is that I started as a registered nurse. I was actually a registered nurse in this hospital and provided direct patient care. I spent many years as the executive in charge of clinical services here, over 21 years, before I moved on to be the CEO at the Brant Community Healthcare System for about the last five years. So for me to come back to the community that where my family is, where my peers are, and where all of the people that I knew growing up are, it's very personally meaningful. Yeah. It's an opportunity for me to, in many ways, sort of contribute back to the organization and contribute back to the community.
Absolutely. Well, welcome back. We're delighted and thrilled to have you back as part of this important team. So thank you. So I'm going to talk a little bit about the future. We know that we've got an exciting future ahead of us. We know that we have a challenging future ahead of us, and we've had a challenging time in healthcare. From your perspective, how do you see fundraising, community support, and philanthropy playing a role in our community in the future, and why is it important?
So if we think about some of the significant challenges that we have at Health Sciences North, and the narrative in the community has been where our organization was built too small. Yeah. We do see emergency department wait times that are climbing. We do experience on a regular basis patients that are unfortunately having to be cared for in hallway, and that while the location of care isn't ideal, I can tell you that they're getting first class care. But we need to look to the future to ensure that we have the capacity to care for our community. So we are in the process now of undertaking plans to redevelop Health Sciences North, particularly on this campus, so that we have the expanded bed capacity and that we have the modern facilities to serve the patient populations into the future, as we think 50 to 100 years out into the future. Again, because Ministry of Health does make a contribution to the capital redevelopment, our community's local share will be really important to enabling that project. And quite honestly, without that community local share, and that local community share being all of Northeast, we won't be able to achieve that outcome alone. So, as we think to the future and we look at those opportunities that we have for expansion and capital, it will be extremely important that we can engage with the community, that we have those foundation dollars, and that we look and to the future together.
Absolutely. What do you think the future capital project means to an individual, living in Sudbury, living in northeastern Ontario, in 10 years from now, in 15 years from now, in 20 years from now? What does healthcare look like for those individuals who need that support?
Yeah, well, so I think as we think about 10 to 15 years out, it means that we have the services here within Northern Ontario for them to be able to access that service. That they don't have to be concerned that if they're living in the communities in northeastern Ontario, that they won't have that service available, nor will they have to necessarily travel all the way down to southern Ontario to get those services. Those services will be here within the north. As we look at service distribution in northeastern Ontario, we probably see services distributed more into communities, and again, but connected back to HSN as a hub to enable that service delivery to be more distributed.